Okay, we are recording. So, assalamu alaikum. Let's go ahead and introduce myself. So, I'm Ali Ahmed. I am a fellow here in Louisville, Kentucky. I went to Shoal, graduated in 2020, and then did my residency at Intermountain Medical Center in Salt Lake City. Graduated in 2023, and now I'm doing this 1-year fellowship in Reconstructive Surgery in Louisville, Kentucky. Dr. Khan, you want to introduce yourself?
Sure. Assalamu alaikum, everyone. Name is Mohammad Junayed Khan. I went to Temple University, School of Podiatry Medicine, class of 2018. Did my residency at Montefiore, Mount Vernon. Graduated in 2021, and I spent a year doing fellowship at University of Pennsylvania, Penn Presbyterian under Scott Millay. It was a research fellowship, and we'll talk a little bit more about that and other fellowships as we get along. And currently attending in Western New York. I work at the Chautauqua Center and operating out of Brooks Hospital.
Assalamu alaikum. I'm Jacob Nasser. I also went to Temple. I graduated class of 2020, and then I went on to do residency at Bridgeport Hospital, part of the Yale New Haven system. And then now I'm doing this 1-year fellowship. It's advanced tissue and wound healing, and it's at St. John's Episcopal Hospital in Far Rockaway, Queens, New York.
Great. Thanks for being here, guys. And then for those who are here, who are not part of the panel, this is supposed to be kind of interactive. I would love for you all to either type in questions, or I know there's a little hand feature if you want to raise your hand, and you can always ask questions. We really want this to be as open as possible. We understand that there's often some sort of a personal block between students, residents, and what you would consider to be your superiors, right? Like your attendings or whatever. We are, all three of us, very open to whatever sort of questions. There's no judgment. If you don't have an idea about what fellowships are, please be open with us so we can give you the best information. And we all know that there's that level of respect that you try to give, and obviously we want this to be a respectful conversation, but feel free to ask whatever sort of appropriate questions that you have. So I've got a PowerPoint here, and Dr. Khan and Dr. Nasser, please just interject as things come up if you need to. So I have a little PowerPoint here. I am a total nerd, and I love Lord of the Rings. So this is Lord of the Rings themed. Of course, if you don't understand this first slide, then you're not going to get the rest of it, but it's okay. So what kind of, so what this is going to be talking about really is, as an overview, should I do a fellowship? What types of fellowships are there? What's the interview situation like? What does the application process look like? And then even what makes a good candidate? And then, we'll also open up to discussion. So reasons to pursue a fellowship. Why should I do a fellowship, right? So some of the reasons, and this is a PowerPoint that I made, so it's very kind of subjective. But reasons that you should maybe pursue a fellowship would be if you wanted some extra surgical training, extra clinical training. So not necessarily surgery, but billing, logistics, how to run a private practice. You kind of get that a little bit of a buffer, right? If you're not the main person who's responsible for the billing, if you're under and attending, and they're really good at private practice billing, they know how to, squeeze out whatever they can out of whatever insurance panels they're on in an ethical way. That would be another reason to, maybe pursue a fellowship in a sense. Mentorship is a big deal, right? So if you go to a fellowship that has, really strong mentors and names, that will really help not only get you a wider network for jobs and whatever it is you're trying to get into, but also, learning specific techniques and things like that. Networking, we talked about that. And then becoming more marketable. I would say this is probably one of the bigger ones when it comes to, podiatrists doing fellowships. It makes you a bit more appealing as a candidate for, I would say, hospital and orthopedic jobs, particularly if you were to try to join an orthopedic practice. Not only that, though, if you're trying to move to an entirely new place, and just having the fact that you're fellowship trained might make it seem more appealing for you as a candidate than someone who is not. Not to say that it can't go one or the other way, but this is more of a blanket statement. But if you were to try to, open up shop somewhere new where you don't have a network, the fact that you're fellowship trained might help with that. And then if you had a specific interest, like a very specific interest, like pediatrics or limb salvage or wound care or research, if you wanted to spend a year doing research and you knew that you wanted to end up in an academic setting, doing a fellowship specifically that has a high research focus would be important. Do you guys have anything else to add there?
Yeah, for sure. So, yeah, I mean, I think a lot of times when people think fellowship, they always think the extra surgical training. And that's without a doubt, just more practice, more reps, doing anything is always going to help, right? Like that's never going to hurt. But, I will say that the extra clinical training or billing and logistics, that's actually very important too. I mean, I went to a program in residency that was more, I guess you could say, well-rounded. So we spent a lot of time in the clinic, wound care. And, I have a lot of colleagues, friends that went to very high-powered, surgical programs, and they're texting me like, hey, how do I take care of this callus? How do I take care of this wart? What material do you use for, for this type of orthotic that you're prescribing, right? And sometimes when you get out in the real world, just honestly speaking, you have to know that stuff too, right? You could be in the OR all day in residency and then join a practice, and not knowing the billing and coding side of things could really, really put you back, especially if you're in an RVU system, especially if you have certain goals and expectations to make. So that's don't devalue a fellowship just because it's not purely surgical. So that's one thing I'd want to say. Mentorship, networking are huge. And this is probably a discussion for probably later in the slides as well. But make sure the mentor, make sure the people that you're working with are going to set you up for a good job, a good career after fellowship. And again, like as Ali said, make sure it can take you to wherever you want it to take you, because honestly speaking, just between 2021 and now, when I finished residency, there have been so many new fellowships opening up. I feel like there are so many new fellowships that opened up, and there's no track record. There's no guarantee that just because you got more training that network is going to help you land a better job than if you just applied out of residency. So you kind of have to do a little bit of research and make sure that you're really getting your bang for your buck that 1 year. Becoming more marketable, I think of the three of us on the panel, I'm the only one that has spent some time out of fellowship, 2 years almost. And, alhamdulillah, I definitely can say I'm more marketable, right? I definitely could say that I'm in negotiating salaries. I came back and said, well, no, this is something you would probably offer a new grad. I'm fellowship trained, and maybe that got me an extra 5,000 to 10,000 more, right? Just an example. More marketable for sure. The way that your practice markets you, they could say, Dr. Khan is fellowship trained in so and so. Research my case. And specific niche interests, again, just applying it to myself. I did my fellowship in research. I could 100% say that through my connections with Dr. Malay, through what I learned in fellowship, I've been able to, speak at, ABFAS, APMA, Goldfarb, you name it, alhamdulillah. And, do some research opportunities with APMA, join some leadership panels. And, alhamdulillah, that's all just within 2 years of graduating fellowship. So that's just kind of how these things apply to me. I think, Ali, you did a great job, listing these things out.
The only other thing that I would add is similar to residency, what you get out of it is what you put in. And I feel like that happens a lot. A lot of people go to the same program but have different experiences. So that's, if you're self-driven, self-motivated, I think that's another reason that, you may take on a fellowship that other people might not.
Yeah, that's a huge point, actually. And I feel like that's great advice for residency. Even I think it took me well into my second year to realize that I was at a program where I really needed to kind of do, I guess, my motivation needed to come from within. It's not like someone is going to come and tell me, hey, there's these cases going on, see if you want to go scrub them, you know. And I think this is maybe we're veering off track a little bit, but some of the more what I would consider to be like esteemed programs for residency and even for fellowship, they have a more, what makes a brand name program, they've got a more robust curriculum. And what I mean by that, or it's more concrete, I guess I should say, where it's like, first you do this, and then you do this, and then you work with this person, and then you work with this person. I would say the vast majority of residency programs and probably fellowship programs are not like that, actually. A lot of fellowship programs and residency programs, you kind of go in there and you've got to do the groundwork as to what's happening and when it's happening, and you got to keep track of that stuff. So keep that in mind as residents too. I mean, maybe if you're part of a large hospital system, see if you can go to the ancillary, satellite campuses and scrub with other people there, for example. Like that, those are all things that you should be looking for. So excellent point, Dr. Nasser, and thanks for your input, Intercon. So going forward, oh yeah, this is another thing too. This is pretty big. So this is a year that you won't be working, So I actually, when I left my residency and started my fellowship, I actually took like a pretty significant pay cut just to do this 1 year of extra training. Now for me, I don't have any kids, and my fellowship was back at home where I was able to kind of stay with family and be close to a network or support system for me. But a lot of people are having to, move across the country with, 4 or 5 kids potentially. And so that's something you got to keep in mind, is that you're going to be at another year where you're not making an attending salary. Now, one could argue when you're an attending, you probably don't make that much anyway in your first couple years, but it's still, I would say, at least half of what you can expect to make in your first year. And if you guys have anything else to add, feel free. So it's definitely something to keep in mind. And then at any point, if anyone has any questions, we did say this in the beginning, but feel free to type it in or just, raise your hand or whatever that is. Okay, I'll keep going then. Unhealthy. So this is kind of a funny, cheeky slide here. So when you're thinking about if I should do a fellowship, I would categorize the following as reasons, maybe not to not do a fellowship, but they're not necessarily the best reasons to do a fellowship. You're expecting to become the next Mr. or Mrs. ABFAS. I mean, this is kind of self-explanatory. Some people think that if you do a fellowship, then you're automatically like on this trajectory to become, the next insert name here, and that I would say those people who are in the highlight or under the spotlight, they have put in the work to be where they are. And it's not just because of their training. A lot of it is self-promotion. A lot of it has to do with the network that they have around them. So just because you do a fellowship doesn't mean that you're going to be like, the scientific chair of whatever, you know what I mean? So expecting to have a career and exclusively in TARs. So what I mean by that is you might do a lot more TARs in fellowship, and it might get you comfortable doing TARs, but just because you do a fellowship doesn't mean you're going to be perfect at doing TARs, for example. I'm just using TARs as an example, but I mean, some of the more complex surgeries or whatever it is, Dr. Jack Schuberth or John Schuberth, you guys should look him up. He is kind of he's like one of the first podiatrists to be doing TARs. And one of the things that he says is you have to have at least 40 under your belt for it to be worth you doing it. Not just for your outcomes, but also for your practice setup. Like your practice needs to be set up in a way to where it's efficient for you to see the post-ops and pre-ops and things like that. So that's what I meant by that. Please don't be offended by anything I say here. This is also kind of a controversial statement, right? Expecting to become an orthopedic surgeon, there's, in my opinion, in my experience as well, like there's always going to be that divide between the orthopedic surgeons and then the podiatrists. If anything, it's because the orthopedic surgeons can take general orthopedic call. So they'll never really look at a podiatrist the same as they do an orthopedic surgeon. So just kind of keep that in mind when you're applying for jobs. If you're applying to an orthopedic practice, just because you're fellowship trained, they will probably look at you a little bit more seriously, but there's still going to be that divide between you and your orthopedic colleagues. And then this is obviously the most unhealthy reason to do a fellowship, is that you told everyone, oh my God, yeah, for sure, I want to do a fellowship, and I'm going to do a fellowship. So these are all reasons that if Boromir was a podiatrist, he would be, this is the reason why he would, right? And for those of you who just joined in a little late, this whole thing is Lord of the Rings themed. That's why this picture's in here. Okay. Anything else to add, guys, on that front?
Yeah, can you go back to that slide?
Sure.
So, I would say once upon a time, there was a point where if you do a fellowship, you could be the next Mr. or Mrs. ABFAS, because fellowships were so few in number that they generally were very competitive, right? Like, say, the pediatric deformity fellowship, or, the deformity correction fellowship. Like, there were very few fellowships that were available, period. And, just like a good job, you'll have hundreds of people applying to them, and only 1 or 2 people would get it, right? Yes, you would be on a trajectory, and those programs, maybe still exist, that are still very competitive, that after PGY 1 or 2, like, that program knows like who they want, right? But for the most part, yeah, I mean, that's spot on. I mean, there's no guarantee you're even gonna land a home run job out of fellowship after doing it. It could take some time. And just expanding upon the TAR discussion that Ali just brought up, there's, I'll just say an example here, the dermatology fellowship in Allentown, right? It's an excellent fellowship, especially if you're trying to fill that niche. You want to do a lot of dermatology, but you have to be realistic. How many jobs are there out there where you can actually work in a dermatology practice, or a plastic surgery practice, or a podiatry school where they need that kind of professor? Very limited, right? Very, very limited. So when I spoke to the current fellow there, because I was actually interested in that fellowship once upon a time, and he said that our fellowship director, he's excellent, he's great to work with, but he's a dermatologist. So his connections in podiatry schools and whatnot they're in that realm. They're in that realm of dermatology, not so much in podiatry. So this is a situation where you could get great training in that niche, but your lack of connections and networking could actually hold you back trying to get you that niche job. So again, great points, but just wanted to throw that in there as well.
Yeah, please. Okay. So next, kind of like, what types of fellowships are there? So generally speaking, they're kind of broken down in these different categories: reconstructive surgery, diabetic limb salvage, or limb salvage in general, wound care, pediatrics, sports medicine, and research. So Dr. Nasser, do you want to tell us a little bit about the limb salvage and wound care side of things when it comes to fellowships?
Certainly. So ours is pretty much outpatient. When I signed on, we were told that there was going to be a little bit more of the inpatient stuff. But that technically is all wounds in the hospital. So really, it's just we see anything from like osteonecrosis of the jaw to diabetic foot wounds. We see wound care taken with, or I should say, treatments differing based on attendings, and not only attendings within podiatry, but amongst different specialties. So we have the general surgeons, we have the vascular surgeons, and then we have our podiatrists as well. So it's cool to kind of see the different ways they approach things. And I'll say, I've noticed they are much, excuse me, quicker to use VACs than I feel like we are in podiatry. That's one thing I've noticed.
That's cool. So I guess one thing that I wanted to bring up is like, honestly, what is reconstructive surgery? Like we talk about this a lot. Like it's a term that gets tossed around a lot. But like, what is it? Right? It's kind of if we think about it, it's kind of an umbrella term, kind of a blanket term for a lot of different things. I mean, it could be something that is related to Charcot, for example. That's one kind of extreme. Charcot reconstruction, right? That's technically a reconstructive surgery, but it could also technically be a bunion, right? Like you're reconstructing their deformity of a bunion. So you have to be really careful when you're looking at these fellowships. If you have a specific interest like Charcot, and you see that your fellowship that you're applying to is a reconstructive fellowship, you have to make sure that you understand exactly what they do, and that would be by looking at their case volumes and what they're doing. So reconstructive surgery really is kind of a broad term. Generally speaking, I can't even say that because some people say recon for like complex deformities. Some people say recon for more of like sports medicine stuff, like, you know, like a brostrum is technically a reconstructive surgery. You're reconstructing the lateral ankle complex, like the ligaments, right? So it just, that's something that I just wanted to bring up. So what types of fellowships are there? When I mean by types, I mean like who, like how is it brought about? Who is sponsoring them? So there's well, I guess I should say sponsoring, but who is accrediting them? There's the ACFAS ones, and there's the CPME fellowships. Those are kind of the two more prominent, what should I say, families of fellowships. And then there's these ones, which we'll kind of get into a little bit. So UTT is under the table, right? And then there's international and there's do it yourself. So those are kind of terms that I've cheekingly put in there. But okay, so ACFAS fellowships. This is straight from the ACFAS website. And I kind of wanted to just point out the language that the ACFAS uses when they're talking about the accreditation of the fellowship. So I'll let you all kind of read this, but you know, basically what they're saying is programs meeting the minimal requirements are officially recognized by the college. Programs are reviewed on an annual basis. Fellows, these programs benefit from lower due rates and recognition of program completion. So I guess what I want to highlight here is that it kind of it says it right here. I mean, programs meeting minimal requirements. I'm not even sure why they really put that in there, because I don't like. Yeah, you would expect that a program would meet minimum requirements, right? But they did want to highlight that in there. So fellowship training, these are kind of the, I guess, definitions of a fellowship by ACFAS. Training represents experience that exceeds that of residency training, offering distinctly unique educational experiences, not merely an extension of continuing residency training or merely the professional grooming under glorification of associate positions. So what they're saying is you don't want to be considered a glorified associate, right? And that's what we hear a lot about with some of these fellowships. When programs are accepted into ACFAS, they generally accepted for unique educational experiences, but are not limited to surgical complexity, diversity, specialty training, unique practice. So it's really vague as to like what can be accepted, and then generally rejected examples would be like if you had a high call or clinical volume or independent fellow call, independent fellow clinic, independent fellow round. So basically what they're saying is they are trying to limit how much independence the fellow has because they want it to be kind of under the supervision of an attending. But again, it is kind of vague there. Yeah, go ahead.
Ali, let me just say one thing about ABFAS fellowship. So it's actually important to note that CPME is actually the only accreditation body within podiatry. So if you look at any residency program, they have CPME certification. So ABFAS is actually not, and correct me if I'm wrong, ABFAS is actually not an accrediting organization.
That's correct.
They recognize certain fellowships meeting the standards that Ali just said, meaning, you know, you can trust that you're not going to be a glorified associate. Well, you know, you should be able to trust based on the minimum criteria. And if a program is not meeting those minimum criteria, they could be put on a probationary status. Like if you go on ABFAS's website, you can see like, okay, this is conditional approval, this is probationary status, because there's probably a flag somewhere. But I mean, I don't know if this is actually a big deal that they're not an accrediting organization, because I always thought that there could be a situation where you apply for a job somewhere and they, you know, say a multi-specialty group, and they say, oh, well, you know, is this an accredited fellowship? And if it's not CPME, you know, accredited, technically the answer is no. And, you know, there are a lot of fellowships that are both ABFAS and CPME accredited, CPME accredited. But there are many that are not, that are just, you know, ABFAS recognized. Yeah. So that's something to keep in mind too. I haven't heard of anyone being in a situation where they're like, oh, I didn't get the job. They didn't recognize my fellowship. I've never heard of that happening, but it's just something to keep in mind because you never know how podiatry changes. But yeah, just wanted to throw that in there.
No, for sure. Absolutely. No, that's a huge point. So this is from the CPME like website, basically at the, kind of their bylaws, I guess. so to speak, about accrediting and fellowships and stuff. But basically, that's what it's just talking about that. So a couple things that I wanted to point out in the CPME and just kind of fellowships in general. So a couple things you want to be sure of is, I guess, how should I put this? You want to be careful when applying to fellowships. The reason I say that is because things are constantly changing on an administrative level. And so you never really know what you are going to be signing up for if you haven't carefully looked into the fellowship. Now, I just wanted to highlight this one, for example. I have heard, and this is secondhand information, but I have heard that the fellows in this program specifically don't really do a ton of like clinical work. And you wouldn't really get that just by looking at this or the website, right? I mean, apparently, I mean, I guess I shouldn't get into the rumors or whatever, but apparently they're not doing a ton of clinical stuff. It's a lot of like more educational, more academic. They're doing a lot of lectures, that sort of stuff, which is great. But it can be a little misleading based off of just the name. So just keep an eye out for that sort of stuff. This one down here, it has an expired, well, it says, what is that? It's intention to voluntarily terminate the fellowship. So that one should no longer be listed on the website, but it still is. So that's just another thing to look out for. And then, yeah, I mean, that's basically it. So anything else to add, guys?
I mean, you know, sorry, go ahead, Jacob.
No, I said I think he nailed it. Nothing for me to add.
Yeah, I mean, definitely, you know, any rumors, anything you hear, that goes for anything. I mean, I know of at least 2 people in, you know, reconstructive fellowships that they're not really scrubbing, they're not really doing much in those big cases. They're just kind of retracting because it could be that the program director or fellowship director has a name, and you know, if it's a bigger case, they're like, oh, sorry, man, I have to protect this outcome. You know, you'll get the next one, and you know, the graduate fellowship not really doing those bigger cases that they were hoping to be comfortable with. So definitely have to ask around. I mean, one piece of advice is just look at who the past graduates were, and you can just Google their names. I mean, typically the past alumni are on the website, and just talk to them. You know, just really know what you're getting yourself into. That's the most important thing I can say about any fellowship program.
For sure. And that goes not just for CPME. I don't want you guys to think that I'm harping on CPME, but even for ACFAS fellowships, that's definitely the case. And what I wanted to kind of highlight with that list of fellowships there, and I guess I should have put an updated one of the ACFAS one. I mean, when I was applying for fellowships, we were talking about maybe about 50 fellowships, and now I think there's closer to 75. Like they're really just kind of popping up, and I don't know that there's a good standard as to what they're looking at for when they're accrediting these or approving them for ACFAS status. UTT fellowship. So this is under the table is what it means, and basically what this is that there's a subset of fellowships out there where there is no formal like approval from a body, like so no ACFAS certification and there's no CPME certification. It's kind of just like, hey, I know this one attending out in insert state where he will hire you for a year and he's doing some cool stuff, so you'll learn how to do that. So I mean, feel free to do that. You know what I mean? It's just it's out there. There's not really a good resource for compiling that information as to like, you know, how to find these. I did have this website here that I wanted to pull up. Let me know if you can still see my screen here. Are you still seeing the PowerPoint or?
I still see Smeagol.
Okay. Let me see if let me try to share the other screen here. Well, you know what? I'll just put the website link in the caption in the chat box here. But basically, there's a website called Foot and Ankle Resource, and they've compiled some information about some what I would consider to be under the table fellowships, and so you can take a look at those as soon as I can figure out how to send it in here. Okay, well, I will send it out. All right, under the table, yes, and then what I consider to be DIY fellowship. So there are people who are like, you know what, I need to do a fellowship. I haven't gotten into any of the ones that I want to get into, and so I'm going to start one. Like, that is a thing that has happened and is happening. If you are so inclined, you can click on these links here, and they will take you to like the ACFAS and CPME fellowship, kind of starting the fellowship process. And I've got some arguments against that. I mean, I think that there's a lack of a standard of the quality of fellowships out there. And so just creating more is going to add fuel to the fire there. But that is an option. So quickly, kind of a timeline for fellowship applications. And then I do want to open this up for some questions, and maybe Dr. Nasser and Khan can talk about their own experience and whatnot. But so the end of first year, you should really be starting to think about your future, and not only just in your career, but like, what do you want your life to look like, right? Like, do you want to be in a busy practice? Do you want to kind of have a chill lifestyle? How much money, like, is money important to you? How much do you want to be making? These are all things you need to be thinking about, where you want to live. Start of PGY2 year, you should really be looking into like the different types of fellowships out there. Middle of PGY2, so rethink your future because it's going to change. Watch out for fellowship webinars, ACFAS, and I think some of the CPME ones too. They do like webinars, things like that. Look out for the various like marketing out there for Podiatry Today, for example. They often talk about fellowships, and ACFAS does. Consider going to the scientific meeting, the fellowship breakfast. That's a thing where you can go and meet a bunch of fellowship directors. I personally don't know how effective it is to go to that. Like my director, for example, he says, oh yeah, I mean, we remember people who have come, but like I never went to the fellowship breakfast, and I got the fellowship that I'm in right now. So, I can't imagine just seeing like 100 people and then trying to remember, oh yeah, they were at the fellowship breakfast, so now their chances of getting this fellowship are higher. I don't think that's true. By the middle of your PGY2 year, you should have developed some sort of a good relationship with some of your attendings. So figure that out, like figure out who you're going to ask for letters of recommendation, because they will take several correspondences to remind them. April, June of PGY2, so that is right now for second years. You need to be sending in your applications and thinking about visiting and interviews. The application process is a little weird because you just have to email the email that's on the website. It's not like a portal where you just submit all your applications. So it is a little strange. And then some people will respond immediately. Some people will respond later. I would always encourage, sending an email after your application about a week later if you haven't heard anything, and say, hey, just wanted to follow up. And then potentially even about visiting. September, October of third year. Sorry, this should say, yeah, so that'd be the start of third year, basically. Most programs will have made a decision by then. I was told about my fellowship that I got it in like August. So you can't really go off of what the website says necessarily. Some of them kind of just make an arbitrary decision. What is your all's, what has your experience been with this, guys? With like applying?
Go ahead, Junayed.
So for me, I mean, I applied for the Presbyterian, research fellowship, which was both ACFAS and CPME approved. So ACFAS, I'm pretty sure they have like a common application. I don't know if that's still the case, but there's just like a common application you have to fill out that you could send to multiple fellowships. So I completed that, and so my kind of like you said, end of my first year, early second year, I started really looking into fellowships. I shot an email to Dr. Malay. By September of my second year, I visited and spent some time with the director, with the current fellow, Alton Johnson. I don't know if you guys heard the name. So we really had to hit it off. We were texting and things like that, and I was just showing a lot of interest. They were working on a research project. I'm like, hey, how can I help? Even though I'm a resident, even though I know I can't do much, just showing interest. And then February of PGY2, I visited again, and that essentially ended up being my like unofficial interview. So I sat down with Malay, Downey, Majinski, the three kind of people who call the shots at 10. I didn't realize that was going to happen. I thought I was just going to visit, and they asked me a bunch of questions. Everything went well, and by like March, they told me that, okay, it's yours if you want it, right? So that happened my PGY2. So, just as Ali said, typically by end of PGY2, early PGY3, like places kind of already know. So if you're a PGY3, looking to do a fellowship, you may be in a little bit of a weird timeline depending on the program you're looking at. So what about you, Jacob?
Yeah, I think you guys hit on all the points. The only thing I think is funny is I thought the fellowship breakfast, or like that's what it's called, right? The fellowship breakfast at ABFAS
Mhm.
for the residents. It was good. I think I met a lot of different directors and got a decent amount of connections, I feel like. But I totally agree with what you're saying, that it by no means, if anything, it gets your foot in the door and it gets you an open line of with whoever you're trying to talk to. And just as everybody said, the earlier you start, the better. I think one of the programs, I think Dr. Siddiqui's program, was taking fellows 2 years out when I was applying. Because I was applying early for a lot of people that they were saying, like I was looking in November of second year, basically right on his timeline here. And still that was too late. So if it is something, it even showing interest if you're not sure, I feel like just to, have that line of communication may be something that bears fruit for you in the future. Even, I think in my situation, a lot of the time, even though it didn't work out, I'm Canadian. I have a visa that needs to be sponsored and needed to be sponsored. And so it's a little bit more difficult in certain situations. But a couple of the directors were like super kind and willing to reach out to other directors on my behalf, even though I didn't know them other than just starting to chat with them at that breakfast. So that's kind of my reasoning, just to say, the flip side of that.
No, for sure. Absolutely. I mean, yeah, it can't hurt, going to this thing and meeting all these people. If anything, for you as a candidate, you'd be able to see all the different types and, what kind of people are there. And if you feel like you'd be a good fit. So I definitely agree.
The only thing that I would say, and correct me if I'm wrong, they wouldn't have CPME fellowships advertising there, right? They would only ever put up their ABFAS fellowships at that.
Right.
At the ABFAS thing, right?
That's
right.
true.
Yeah. So
good point.
Something else to consider, because I don't think there's anywhere else that you can see or like tour other fellowships if you're interested. I think it's just like they were saying, direct message to what's on the website or whatever the email correspondence is.
Yeah.
It's almost like applying for a job. It's like, we're so used to, the residency, the match and all that, but it's almost like applying for a job. Just contact them. But yeah, Jacob, you brought up a great point. I mean, some of these programs, PGY1, you're applying and getting accepted, then that's tough, because PGY1, you don't really know what you want a lot of times. You're just doing amps and debridements in the most programs, and to do something in pediatrics or recon, it's tough to make that decision that early on. So it's tough for sure.
And then, so by December of your third year, you should definitely consider it closed. I mean, there might be some things out there, maybe like I said, the under the table ones, or I know Johns Hopkins actually just started a fellowship under their vascular department where they're employing a podiatry, and they're calling it a fellow. So that's kind of a cool experience, but it's not going to be under ABFAS or CPME. But for the most part, consider the CPME and ACFAS ones, consider that kind of like done. Jake, do you mind looking at this chat? I can't see it for some reason. I think someone just asked a question.
Yeah, I'm pulling it up. Hi, everyone. Salam. How would you, if you would amend this timeline for a third year student interested in potentially pursuing a fellowship?
A third year student?
Yes, a third year student, not third year resident, correct?
Okay.
That's what the message says.
Yeah, I mean, do you have any thoughts, Jacob?
Yeah, I mean, if you're a third year student, you've got lots of time, right? I mean, I think as a third year student, what I was looking at, because I thought I really wanted to do big Charcot reconstructions and stuff like that. So one of our attendings, Dr. Quadu, I made a point of trying to get in all of his bigger cases when I was at Temple. And when I was there, I think the first case I did with him was like an 8.5-hour Charcot. And I left that OR being like, man, my back hurts. I don't know if I could do this forever. So I think, as simple as it is, just being a good judge of your own character to say, is this something, like, don't cheat yourself, is this something that you really want? And if that the answer is yes, then go for it. But don't just do it kind of to the other point. You told somebody you're going to do a fellowship or anything of that nature, Find what your favorite cases are, because that's probably what your favorite cases when you're watching them are probably going to be the same ones that you enjoy doing yourself. And I can say that from my own personal experience. But I think as a third-year student, make sure you get as much opportunity in the OR, in which you should be doing probably next year. And at that point, just, make a pros and cons list of all the bigger cases or all the cases that you find yourself enjoying. And if you find a niche there that you want to, pursue a fellowship or pursue further training, then go for it. But I think these guys have nailed everything so far. I would agree completely.
Cool. Fellowship interviews.
So let me add one more thing to what Jacob said. Jacob answered that perfectly. I mean, the only thing I would also add is when you are looking at these bigger cases as a student, or cases that you think that you like, if you realize like, oh, I really like that Charcot case, instead of looking into like, oh, well, I want to do this fellowship after residency, why don't you look at residencies, right? There are some residencies that do so much advanced, Charcot recon that like, you don't really need a fellowship, to be honest, because that residency is doing so much of it. And that could come at the expense of doing less trauma, less recon, less. But I mean, you can achieve that goal that way, right? And I could say the same about total ankles. There are a few programs in the country where you are doing 40 total ankles as a resident, most of the case, where you may not actually need to do a fellowship for that. So don't worry so much about like what fellowship do I want. Just think about like what niche or what type of cases do I want, and try to get that out of your residency first. That's the only thing I would add to what Jacob said.
Yeah, absolutely. And also see like what the residents at the programs that you're interested in, what do they end up doing afterwards? Like, are a lot of them going to, are they working straight after residency? Are they getting fellowships or, but also, I don't know if that's good advice, because everyone's so different. I feel like in residency, it's hard to say, but, let's keep going. And then starting in a couple minutes, I just want to open it up to like question Q&A. These are just some things you guys can maybe just like screenshot this if you wanted to. Things to ask at your interviews. It's always a good thing to ask something after your interview. Just when they ask you if you have any questions, these are things to ask. So things to look into when you're selecting them. So things that I consider make good fellowship candidates. Connections is huge. Having publications or a really swole CV, like a really stacked CV, is helpful, obviously. And showing early interest, like even as a end of your first year, if you email someone and say, hey, I'm kind of interested in this, is there a way that I can come visit? That would be a way to, get some face time in with them. Being personable. A lot of times, just like residency, people just want someone cool to chill with for a year. To be honest with you, if you're a total weirdo, like, it's just not pleasant to be around you, and your fellowship director is going to feel the same way. Again, connections, because I can't reiterate this enough. Like, just knowing who is there and having a good relationship with them will be helpful. Or if you know someone who knows someone, like, definitely this is the time to use that. Having compelling interest. If you have a really, unique story about why you're interested in a specific niche, that is always, helpful. Strong letters of recommendation and connections, again, because that, I feel like, plays such a big role in advancing your career at all stages. So take home points. No one can tell you if you should do a fellowship, and don't let others pressure you into doing or not doing one. Like, oh, all my friends are doing one, so I feel like I should, or I feel like the trend of podiatry is to go that way, which it might be the case, but it doesn't mean that you should be doing a fellowship necessarily. Connections, I can't stress that enough. Apply very early, earlier than you would think, and kind of follow that timeline as an example. It's not necessarily the most glamorous thing ever. I mean, just in my own experience, and maybe these guys can talk about it too, it really, like, you really test how much like BS you can put up with. That's basically what the fellowship is. It's like, how much do you want this? And they really do test you with that. Mine's private practice based, so there is call, and there's a lot of that dirty stuff that you don't really like to do. But if you really want it and you have a goal in mind, then it's worth it. And just know that it may or may not lead into a more advanced practice. Like Dr. Khan was saying earlier, like just because you do a bunch of TARs doesn't mean that your practice is necessarily going to be set up like that. Or if you have a specific niche, like dermatopathology or whatever it was that you said, doesn't mean that you're necessarily going to be for sure going to like teach at whatever school or whatever it is. So just things to keep in mind. And from an outside perspective, like from the medical world, or even for your patients, a fellowship is a fellowship. So don't like, if you get a fellowship, that's great. If you get one that has a great name, like that's great. But at the end of the day, like you're fellowship trained, and it's hard to really pick that distinction out from an outside perspective. And that's it. I had some papers here as well. Financial implications of podiatrics or foot and ankle fellowships worth it. They said maybe positively affecting career earnings. So there's that. Podiatric fellowships in podiatric medicine. These are just like improvements that can be made. And then does it help close the gap for if you're a female fellow? Does doing a fellowship help the pay gap? And they said it's unclear. So sorry about that, to our sisters out here, but it's unclear. Work to be done. So let's just go ahead and open this up to question and answer. If anyone has anything else that they want to say. Was there another question in the chat box?
Yeah, there was another question that popped in. It said, do we have a list of fellowships that would sponsor H-1B visas? So the answer is no, unless these guys have one, which I'd be shocked about. So the way that I went about it, I'm on the same visa. I emailed every program. You're going to get a lot of no responses, and you're going to get a lot of no's, but I would say it's never hurts to ask, you know, even if they don't know, something that they can inquire about. That's, you know, a positive and a plus for you. So, the program that I'm at obviously does sponsor. If you want that information, I'd be happy to share that. Otherwise, unfortunately, you just gotta go individually.
I might just have you read out the questions. Yeah.
Yep, I got you. How can we find out if a fellowship is more clinical based versus surgical? I think I'll let you guys answer this one, but my personal response would be just talking to past fellows and current fellows, right? I mean, those are going to be the people that are most honest with you because they are done and out of that program or they're finishing that program. And you'll probably, you know, sometimes you get a little bit more honesty out of the people that have been gone for a little bit, but I would say by and large, you know, as long as you're like Doc said, you know, as long as you're reasonable, you're not a weirdo, people are going to be pretty honest with you, at least in my experience. So, gentlemen.
Yeah, I agree. And I think the other thing about fellowship is it's not residency. In residency, everyone wants to make their program look like they're doing everything all the time, right? In fellowship, like literally on the website, on, you know, ABFAS or CPME, it'll tell you, like, for example, my fellowship, research fellowship, it says the goal of this fellowship is not to hone your surgical skills, right? Some will tell you that this is meant to enhance billing and coding, you know, career in private practice. Like, people are a little bit more straightforward about it. But for sure, you have to do your due diligence and ask, you know, past.
We lost him. But you got to do your due diligence, and that's the key. So, moving on, we'll if he pops back on, we'll let him finish his train of thought.
There you go. I think he's back.
Sorry, what was the last thing?
Maybe not. All right.
I said.
You got to do your due diligence.
Yes. All right. So, yeah, I would add, I mean, if you're just going based off of like probabilities, I would say that maybe more like academic centers, like a university-based fellowship, would probably have more of an emphasis on education. It would probably have more of a concrete curriculum, versus a private practice one, just generally speaking, again, or hospital-based ones. The private practice ones, I mean, some of them are good, but some of them will treat you like a glorified associate. So it's hard to say. It's hard to say. So keep that in mind, along with the other things I was talking about in terms of like, where do you want to live and what sort of setting do you want to practice in? Like, those would be reasons to pick certain fellowships versus others.
And obviously this isn't very feasible, but visiting, the ones that you're very serious about is going to be important, because that's going to help you not only, most of them that I went to were 2-day visits. So you do get a good lay of the land, you know what I mean? And you'll get a feel for what are you doing in those 2 days? Is one day the surgical day? Is that why they're bringing you in specifically on that day? Or, whatever it may be. So that would be the other thing to keep in mind, to try and see if you can visit and get your foot in the door that way.
Cool.
I got another question. You want me to read?
Yeah, please.
How would you recommend an interested resident reach out as a first contact to a fellowship director? Is an email sufficient?
I would say so. Yeah.
Yeah, I agree. I think majority of my contacts
I agree,
first time around. Sorry, Dr. Khan, go ahead.
No, I was just going to say, I agree. Email is perfect.
Yeah. I think they will give you their phone number or whatever when they feel more comfortable, or when they're ready to, have you come visit or whatever else. But I think that first line of communication with email is the way to go for sure.
Yeah. Agreed.
All right. I think we answered all the questions. I'm going to scope through really quickly.
Yeah, we really did. Do you guys just kind of want to talk about your experience, I guess, in fellowship, or things you would have done differently, perhaps, or not done differently?
Yeah. Can you guys hear me, or am I still in and out?
Yeah,
No,
you're
good.
good.
I'm good. Okay. Now, I wanted to add one more thing before I talk about that. So, Ali, you mentioned, John Hopkins has like a do-it-yourself fellowship. So sometimes those are like really, really like golden like opportunities,
yeah.
because that's typically a sign that a program is like expanding, and you could be, the first podiatrist that they hire after that, and you could be, the director of a residency or whatever that, someday. So those are like, keep an eye out for those, man. Those are golden opportunities. Don't be dissuaded just because it's not accredited.
Right.
How do you guys feel about that? I'm sure you guys probably came across a few of those.
Yeah, I know, absolutely. Especially that Johns Hopkins ones. If I was open to living in Baltimore for a year, I would have definitely applied for that, because that is that's a hidden gem, honestly. I mean, not so hidden, right? It's Johns Hopkins, great name behind it. You'll be in a vascular surgery department, so if you see that, I mean, you should know that it's predominantly going to be, wound care and potentially
Right.
some diabetic, like limb salvage and stuff like that. But even that, I mean, that can be an amazing opportunity. I feel like it would be very well compensated in that role. And then, like Dr. Khan said, like, you would be part of something that's potentially growing too. And having Johns Hopkins behind your name, that's amazing.
Right. And, guys, like, correct me if I'm wrong, but you'll find that a lot of jobs in these academic, institutions, Hopkins, University of Michigan, whatever the case, like, oftentimes podiatry, you have a trauma unit, you have orthopedics, foot and ankle there. Oftentimes podiatry kind of does fill that niche, more common than not. They're doing a lot of the limb salvage, they're working with vascular, they're working with endocrinology. That's more common than you might think. So, don't join a place thinking, oh, well, it's just limb salvage, I don't want to do it. So, I mean, that's just kind of what I've seen.
Mm-hmm.
And I'll say it again, what you put in is what you get out.
Mm-hmm.
That's what it comes down to, kind of to everybody's point. It doesn't really matter where you go, whether it's accredited or not. If you put in the work and you ask the right questions, you'll get the benefit. And that's the one thing that I wish I did a little bit more of in residency, was ask the billing questions, because I started doing billing when I got here for this fellowship, which has been helpful. Obviously, it's very targeted billing, but just being able to pick the brains of your attending and having that ability, I would try to utilize that as much as possible.
Definitely. No, that's a great point. I knew nothing about billing before coming to this program. And It's gonna be. I feel like I'm learning a lot more than I'm gonna need, to be honest, because I'm gonna be working at like a hospital setting. So knowing the private practice part of it, I mean, it's great. Like I wouldn't. I don't. I'm not saying that I don't need to know it, but I'm definitely learning a lot more than I feel like I will need in the future. So it's pretty cool.
Mhm. So I'm just a, I actually didn't answer the question you guys asked me. Sorry about that. But yeah, what my day looked like. I think you asked me what a day looked like in
Yeah.
fellowship for me, right? So basically it was 50-50. I was in a research fellowship. So half the time I was in clinic and the other half the time we were doing research. So I actually took, at the University of Pennsylvania's medical school, it was a certificate program for like basically clinical research. So I was taking biostatistics, epidemiology, just kind of things like that, database management, and then we just did independent research, right? And like these guys keep saying, what you put in is what you get out. And if you have someone that just, and you can tell right away who wants to be there and who doesn't. If you just want to sit around and screw around, you can do that, but no one's going to be happy with you. And that goes for any fellowship. There's always a self-driven component to it. And for me, I did as much as I could in that year with the UPenn faculty and the residents. Honestly, I mean, the residents were great there too. But yeah, that's what my day kind of looked like. It was 50-50. I was not in the OR at all. And you also have to look at yourself. I mean, I also visited the dermatology fellowship, as I mentioned, and at both programs there were a lot of other people interviewing and visiting who they wanted to be non-op right after residency. So you also have to look at yourself as well. If you're someone that does want to do maybe more clinical side of things, and maybe you don't want to join a multi-specialty group, and maybe that narrows down your options. So, but what about you, Jacob and Ali? How's your day look? I mean, you guys are still in fellowship.
I'll let
Go
you
ahead,
go
man.
first.
Okay, sure. So mine's private practice based. So there's like 9 attendings that we can work with. 6 of them are pretty surgical, I would say. And then there's kind of the director and the assistant director. And so each of them has like a block of surgery almost daily. There are some days where we don't have surgeries and we're kind of in clinic. There are 2 afternoon days that we have our own clinic. So that's kind of nice. Like there's no other supervision there. We're kind of just calling the shots and, putting in doing whatever procedures we need to in the office, and also booking for surgery. The surgeries at my program are the ones that we do on our own completely are just the on-call ones, so the dirty ones. But if there's any like elective surgeries, those aren't technically our own, but we are doing them skin to skin, and they are I would say we probably have about 7 to 10 cases per week, so it's not like crazy busy. I've definitely heard of some more that are a bit more rigorous, but they also kind of harp on the work-life balance that this one offers us. So there's a little bit of that component of like just the busy work, right? But I mean that's anywhere.
So you're doing tons of surgery. How many cases are you at right now?
Right now I'm at about last time I checked, I think it was 250. So it's again it's not like crazy high, but there are some
That's still a lot, man.
Yeah, that's still quite a bit.
I mean, yeah. I mean, it's a good amount.
Mashallah, he's just a humble
Definitely.
guy. So mine's a lot more chill. It is just strictly outpatient wound care. So we do it. We also have a hyperbaric chamber. We get hyperbaric certified. So I just sat for my course back in end of March. 7 to 4, and we do not take call.
Ugh.
And yeah, it's a pretty cushy gig. Can't complain. And there's no weekends. So
Oh my God.
I'm making this guy so upset right now. So I'm gonna just stop talking there. If anybody's interested in the information, I would be happy to share it. I'm sure the same would be said for these gentlemen. And any further information, you guys can always reach out.
So Ali, I had a question for you. So the
Yeah.
cases you're doing by yourself, can you actually log them for your ABFAS certification or no?
Yes. So the ones that we do by ourselves are the call ones, and so we're seeing them before and afterwards. So we're getting pre-op and post-op images, so we can. log those for ABFAS. So I'm told. I haven't done any yet, but
So make sure you do that before you leave. Otherwise, it's going to be a massive headache getting it afterward.
true.
But just a note about that. So yeah, there are some ABFAS recognized fellowships, and that is the benefit of it being ABFAS recognized. That it's very easy to log some of these for your ABFAS certification, but you have to be the primary surgeon on that case. So some people go in with the expectation of, oh well, I'm going to do 40 total ankles, whatever, a month. I don't know if that's realistic, and they're going to be for my logs. Well, no, that's not the case if you're not the primary surgeon. And typically, you probably won't be in fellowship if I had to guess, but I'll ask that question as well. Like, do I have the opportunity to log cases for my ABFAS with this? Because a lot of people go in, again, misled a little bit. So.
And then there's also you need a verification that you're a primary on that, and so I've been told that the best way to do that is to just grab the post-op anesthesia note, because they will have that listed on there as you as the primary surgeon. So that doesn't really apply to anyone here other than the three of us, but cool. Are there any other questions out here before we adjourn?
Nothing here on the chat.
Okay. Well, thank you to our panelists for taking the time to do this. Dr. Khan risking his life again for the Muslim Podiatry Network here. And just again, people who are here, we're members of what we call the Muslim Podiatry Network. Basically what we're doing is we're trying to spread awareness of, or actually mostly what we're trying to do is be a unifying voice and body for Muslim professionals and non-Muslim professionals whoever wants to be a part of our organization. You definitely can. There's no fees or anything like that. We're really just on Instagram right now. So feel free to email muslimpodiatrynetwork@gmail.com. We're happy to add you to our mailing list and just to kind of see what we're about. We also are trying to showcase a lot of volunteering efforts that we're doing around the country. We are trying to set up some surgical and medical mission trips as well. So it's just a fun way to get involved. Anything else, guys?
Thank you, brother. Thank you, Jazakallah khairan, for moderating this whole thing. And inshallah, everyone that's here, if it was beneficial, let us know. If you guys have any feedback or things you want us to do differently, just email us and let us know, how we can make it better. We're always open to feedback.
Great. With that,
I said it better myself.
There you go. All right. With that, assalamu alaikum, everybody, and be easy.
Walaikum assalam. Take care, guys.
Walaikum assalam.